This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting-edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hello, Rational Wellness Podcasters. Thank you so much for joining me again today. And for those of you who enjoy listening to the Rational Wellness Podcast, please go to iTunes and give us a ratings and review. That way more people can find out about the Rational Wellness Podcast. Our topic for today is fatigue and cancer with Dr. Lise Alschuler. The National Comprehensive Cancer Network says that cancer-related fatigue is a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. Pain is very common in cancer, and up to 80% of patients receiving chemotherapy or radiation and cancer survivors report that fatigue is a disruptive symptom months and even years after treatment ends. I meant to say fatigue is a common symptom in cancer. Fatigue in cancer is underreported, underdiagnosed, and undertreated. That's because cancer doctors tend to focus on patients' pain and tend not to pay attention to fatigue, even though many patients report that the fatigue is their most distressing symptom. Dr. Lise Alschuler is a naturopathic doctor with board certification in naturopathic oncology. She was past president of the Oncology Association of Naturopathic Physicians. She's executive director of TAP Integrative, a nonprofit educational resource for integrative physicians, which I use regularly and very, very helpful. They have tons of great educational videos and other information, and the service also includes free retrieval of full journal articles, all for the price of the annual membership, which I take full advantage of. Dr. Alschuler wrote The Definitive Guide to Cancer and The Definitive Guide to Thriving After Cancer, and the Definitive Guide to Cancer is just an amazing resource, and anybody who sees cancer patients, you have to have that book as a resource. Dr. Alschuler sees cancer patients in Scottsdale, Arizona. She's a sought-after speaker at conferences around the world. She co-hosts a radio show, 5 to Thrive Live, on the Cancer Support Network, and she's also a cancer survivor herself. Dr. Alschuler, thank you so much for joining me today.
My pleasure, Dr. Weitz. It's nice to talk to you again. It's been a while, so I'm looking forward to it.
Absolutely. So what are some of the reasons that cancer patients get fatigue?
You know, it's a really, first of all, I want to just emphasize the introduction that this kind of fatigue is not the kind of fatigue that maybe we all think of, like the fatigue that we get when we're working too hard and we just need to sleep in on the weekends and then we kind of wake up rejuvenated. This is not a fatigue that people can sleep off. It's not something they can recover from. It's a very debilitating fatigue, and it's associated actually with anxiety, with depression, with cognitive dysfunction. It's a very deep-seated fatigue. I think from a functional perspective, we would think of this kind of fatigue as the fatigue that is happening on a cellular or even mitochondrial level and is really gotten to a point where it's influenced our endocrine system. So it's obviously going to take quite some effort to get people out of this type of fatigue. But so I just wanted to really emphasize this type of fatigue is quite different. And as you said, the majority of people going through cancer and treatment, upwards of 80% have this kind of fatigue. It may not be severe, it may be sort of moderate, but even mild cancer-related fatigue is pretty significant. And some people, fortunately, probably over half do kind of spontaneously, as we would say, their innate healing process takes over and they can overcome the fatigue maybe 6 months out from their diagnosis, but the rest can have it for years and years and years. So this is something, I think, a prime opportunity for integrative practitioners to really jump in on. And now that I've taken us on this tangent, I don't even remember your question.
No, that's great. How much of the fatigue you think is related to the cancer versus the cancer treatment?
Yeah, I think that the majority of the fatigue is related to the cancer. And I think that the treatment is basically jumps onto that. The reason I say that is because there seem to be some emerging underlying mechanisms that are becoming commonly accepted. So one is that there's clearly a cytokine aberration in cancer-related fatigue. We think that it probably is sort of the main culprit is high levels of tumor necrosis factor alpha. And then along with that, of course, we have interleukin-6. Those two, when they're in high levels, the classic symptoms is fatigue. So there's definitely something to do with cytokine. And cancer, when you have a malignancy, there is cytokine aberrations as a result of the malignancy. Either the malignant cells are secreting these cytokines in high levels because of upregulated NF-kappa B in those cells, or the stromal response are in and around those cancer cells. There's a high level of inflammation. So I think it's mostly the cancer, but you take that kind of inflammatory simmering mix and you throw some chemo in there and you're just going to aggravate those inflammatory cytokines. One of the next phases of cancer-related fatigue then is the circadian rhythm disruption and the hypothalamic pituitary adrenal axis dysfunction. And that system, as we know, is also very sensitive to cytokine-induced oxidative stress. So I think that that's kind of a secondary event in the sort of continuum of cancer-related fatigue.
So you mentioned the circadian rhythm, and cancer patients often have trouble sleeping, either as a side effect of treatment or due to stress or due to other factors. What role does sleep play in this?
Yeah, it's a really important point. So as I mentioned earlier, if somebody has cancer-related fatigue and they just say, okay, I'm just going to sleep for 8 hours a night, they still may have cancer-related fatigue if the mitochondrial dysfunction is not addressed, if the inflammation isn't mitigated, and if the circadian rhythm isn't reinstated. That being said, all those three things won't do anything for somebody if they're not sleeping. So sleep is essential. It's an essential component to recovery. And as you mentioned, a lot of people who go through this disease and treatments, because their circadian rhythm is so disrupted and so shifted, their sleep cycle gets very disrupted as well. So one of the key kind of cornerstones, if you will, of addressing recovery and survivorship is to reinstate circadian rhythm, and as a component of that, sleep.
So let's say the person normally wakes up every day at 6 or 7 or 8 in the morning, goes to work, goes through their day, et cetera, et cetera. Now they get cancer and maybe they're off work and their schedule changes, so it kind of throws their circadian rhythm off. Is it better for them to just go back to waking up every day at 7 and having their regular schedule? Is that something that's beneficial?
Yeah, I think it is. There's, now that we're learning more about the circadian rhythm, I think that we understand how sensitive it is to what I call ritual and rhythm. And, the more ritual and rhythm we have in our day-to-day lives, the easier it is for us to have a healthy circadian rhythm. And remember that even within the last 10 years, we've just now discovered clock genes, which occur in every cell throughout our body, are directly tied to the circadian rhythm. They only function or turn on in accordance with the circadian rhythm. And most of the genes controlled by clock genes are involved in really important things like cell repair, cell cleanup, autophagy. So we want to have our circadian rhythm intact for lots of reasons, that being a primary one. So yes, to go back to your question, if somebody had kind of a rhythm, a rhythm that they were used to, now they're off work, their rhythm's kind of all crazy, it would really be helpful to try to go back as closely as possible to what they had before, assuming that that rhythm was optimal for them.
When you're treating a patient who has cancer-related fatigue, do you, when you work them up, do you try to sort through which, what are some of the causes of the fatigue? Like, for example, do you measure cytokines? Are there certain questionnaires you use? Do you try to figure out, how much is hormonal, how much is related to different factors in coming up with a treatment plan?
Yeah, I often do. Not 100% of the time. If I have a good kind of, I don't know if it's intuitive hit or just having done this for a while hit, but if I'm really wanting to be very precise, then yes. So I'll do a adrenal stress index test. So measure cortisol at 4 points over the 24-hour period, get a really good sense of their cortisol awakening response as well as their full circadian rhythm. And then I do often measure.
That's the new part of the adrenal stress test, is the cortisol awakening response, where you're measuring how their cortisol changes in the first 30 minutes after awakening.
Yeah, I haven't seen a normal one yet, but I'm still holding out for it. But I think it is important. There's really actually a pretty substantial body of literature just on cortisol awakening response in relationship to depression and anxiety and all sorts of things. So yeah, adrenal function for sure. I do measure cytokines for this purpose, and also just as a way to assess, to some extent, what's the milieu of this person like, so that I have I can determine whether or not they are more or less at risk for recurrence. So the cytokines I will most commonly measure include C-reactive protein as an acute phase reactant, interleukin-6 I definitely look at. And those two alone are usually enough to do it. There's another inflammatory test that I have started to use quite a bit. It's a urine test, and it measures 11-dehydrothromboxane B2, which is a measurable metabolite of the arachidonic acid LOX and COX pathways. Okay. So it's a very important way to assess the sort of eicosanoid side of inflammation, and then the CRF and the IL-6 sort of measure the genetic side of the inflammation, the NF-kappa B upregulation side. So all that together can give me a pretty good sense of what's going on. And then sometimes I might also see if there's any evidence of oxidative stress, which would be another indication of the fact that there's upregulated inflammation. So looking at like 8-hydroxydeguanosine would be kind of my go-to.
Okay, so oxidative stress means that there's not enough, say, antioxidants to block some of the excessive oxidative stress. And of course, oxidative stress is often part of the chemotherapy if they're getting chemo.
Yeah, most everybody who goes through cancer and its treatments will be depleted from an antioxidant perspective at the conclusion of that treatment. So typically some degree of repletion is necessary. It doesn't necessarily have to be supplementation. A good plant-based, vegetable and fruit-rich diet can restore people's antioxidant capacities. But it's very common, and that oxidative stress is a contributor to the HPA, hypothalamic, pituitary, adrenal, circadian rhythm dysfunction, as well as a contributing factor to mitochondrial dysfunction, both of which, as we talked earlier, are related to fatigue.
I know we've discussed this in the past, but where are we in terms of the use of antioxidants during cancer treatment?
It's again, I think that the controversy, I would say, is a little bit muted right now, and maybe because we're starting to get a little bit more savvy and realize that when we say antioxidants, we're talking about such a large and diverse group of compounds, some of which are problematic with certain chemotherapy agents or certain radiation treatments, some of which are actually very helpful. So I think we have to sort of say, not the question shouldn't be, are antioxidants safe or not? The question should be, can I use X, Y, or Z?
Right.
Then we have data now that we can answer that very specific to the actual treatment that somebody's getting, their cancer type even, and figure out, yeah, you are a prime candidate for using this antioxidant, or nope, this is not good for you.
Okay, good. And does that apply to the newer drugs, the targeted drugs?
So that, as you mentioned, cancer treatment is changing. Hopefully someday chemotherapy will be a thing of the past, but we're not quite there yet. But more and more we're moving towards sort of molecular-based therapies or antibody-based therapies or immunotherapies. So these all target tumors in one way or another by either capitalizing on a genetic aberration in the cancer and targeting that very precisely, or by stimulating our own innate healing mechanisms, like the immunotherapy is essentially unbreaking the immune system to attack. And we're getting a lot more sophisticated with all this. Now, because this is all new and it's happening so fast and there's new drugs in trial all the time, we in the integrative space are playing catch up for sure. And we just are really in a place of trying to understand what we have that's helpful, not contraindicated. Generally speaking, this is an area where it would really be important to be under the care of an integrative practitioner with expertise in integrative oncology, because like even me, when I have a patient and that's all I do is integrative oncology. And when I have a patient, I get patients every week with new drugs I haven't heard of. So I have to research the drug and really understand its mechanism, its metabolism. And then I have to apply that with a knowledge of its side effect profile, figure out what I have to use, see if there's any potential for interaction, and be very cautious around that whole thing. And so it takes a lot of time and effort. So it's not, we're still learning. That was a long-winded answer, but...
I was looking at some studies on some of this stuff, and a couple of the papers were mentioning the part of the cytochrome P450 pathway that this nutrient affects and that could interfere with this drug. And then you start going, oh my God, you can't take this, you can't take that. And then you start looking at the drugs and you realize that this cocktail of cancer drugs, they're actually interfering with each other. And 9 other things that they're taking, to control their blood pressure and everything's, interacting on these cytochrome P450 pathways. And so it occurs to me that if you use that as the basis for not, eating something, it's way too complicated to use that as a rule out, don't you think?
Well, I think so, eating for sure, but I think that with supplements, the challenge is that, so first of all, a good practitioner, conventional practitioner will do a drug-drug interaction check when they've introduced chemo to make sure, because and sometimes I've seen patients get pulled off of pre-existing antihypertensive drugs or whatever because of potential interaction. That being said, there are some that are left, but the degree of the interaction can really vary. So it may have a little interaction, but it's not clinically significant.
Okay.
And so a lot of the nutrients in herbs, the data we have is preclinical, and that has almost no relevance to what happens in the human. So really, I look for human pharmacokinetic studies so that I can see, is there really a potential for interaction here? And that being said, if somebody's on a small targeted molecule type of therapy, which has a very small dose and a very narrow, kind of a very, the blood dose, the concentration that is targeted is very narrow, I don't want to mess with that, because if I mess with that, I could run the risk of increasing side effects and, who knows what. So, in general, it's best to be cautious with drugs that have a high percentage of toxicity.
Right. Okay. So back to the fatigue. What role does anemia play, which is a common side effect of a lot of chemo?
Yeah, so it's a really good point. So generally speaking, when we're talking about cancer-related fatigue, that's in medical kind of perspective, that has the assumption that we've ruled out known causes of fatigue. So if somebody comes to treatment, I'm tired, we need to check. Are they anemic? Do they have thyroid dysfunction? Or are there any other obvious causes of fatigue, an obvious nutrient deficiency, for example? Address all that. And if that takes care of the fatigue, we're good. If they're still tired, then they have this cancer-related fatigue.
Do you have a certain panel you like for assessing nutrients? Because there's a lot of controversy as to the best way to assess nutrients, because a lot of times just serum levels are not really indicative of tissue levels, etc.
Yeah, so I don't run serum vitamin levels except for vitamin D, and vitamin D deficiency is associated with fatigue, so that's one that we want to check.
Right.
I do look at red blood cell zinc, red blood cell magnesium. I think those are very accurate and nice reflections. To get at like B vitamins in general, I typically run a urinary organic acids test.
Okay.
Yeah, which kind of looks at the metabolites from the TCA or the Krebs cycle, where we use B vitamins to make energy. So we can tell by the ratio of metabolites whether we're lacking certain B vitamins or we have, kind of a blockage in that pathway.
Yeah. Have you used the Nutri Val? Do you like that test?
I have ordered that on occasion, and I think that it provides a really broad view of nutrient status. So I think it can be helpful. I'm not 100% sure, and this could just be my ignorance of the data, but I'm not 100% sure that snapshot in time is truly representative of an ongoing functional deficiency that's related to symptoms or pathology. So I'm not sure how actionable some of that information is, and there's always a range. So like, what's really the cutoff?
Yeah.
You start to where it, indicates, yes, we need to give this person this supplement. So I still have some questions around that, but I think it can be a guide.
Yeah, because it includes an organic acids, and then there's also some red blood cell minerals, and so throw in some other stuff. What type of diet? So diet's very controversial when it comes to cancer. And when we have patients with cancer with fatigue, you want to make sure they're getting the right nutrients to give them energy. We often think of carbohydrates for energy, but these days, one of the more popular strategies for dieting cancer is to use a lower carb approach, a ketogenic approach, maybe intermittent fasting. What's your take on that? How does that interact with fatigue?
Yeah, excellent question. So with cancer-related fatigue, again, because it's primarily a cytokine disorder, the diet interventions that are going to lower inflammatory cytokines are going to be the ones that will be most effective. So, for example, intermittent fasting, we know lowers CRF, high sensitivity C-reactive protein.
Right.
So we know that when we overnight fast, we lower inflammation in the body. So that's a perfect dietary strategy for somebody with cancer-related fatigue. My goal is 13 hours of an overnight fast. Anything above that's bonus, but 13 hours is kind of the magic number from a research perspective. And then beyond that.
What about fasting? Some clinics are recommending fasting the day of chemo, maybe the day before, the day after, or some level of complete fasting, all centered around when they get their chemo.
Yeah, so that's kind of a separate strategy in terms of minimizing some of the toxicity from the chemo, particularly to the digestive tract. It does appear maybe in some people to also improve people's energy a little bit in the time of getting chemo. Whether that has any impact on post-treatment cancer-related fatigue is, to my knowledge, not known. I haven't personally observed a strong correlation there, but it may. I don't know.
Okay. Sorry to throw you off track.
Yeah, no, that's fine. But yeah, post-treatment, I think intermittent overnight fasting, definitely. I would not go for a high carb diet unless you're talking about complex carbs from, vegetables, fruits, whole grains. But simple carbs, although they give us immediate energy, are very oxidative over time. So that's going to worsen the cancer-related fatigue. So really what's more important is two things. Number one, fat. And it doesn't have to be necessarily a ketogenic diet, but we know that omega-3 fatty acids, and actually there was a very recent study that somewhat surprisingly found that soy oil was more effective than fish oil in reducing cancer-related fatigue.
Really?
Yeah, which is kind of crazy, but they attributed that to the soy oil's content of omega-6 and omega-9,
What?
And that had a decreasing effect on tumor necrosis factor alpha. Kind of interesting. I don't know. It's a sort of an outlier for me, but I think really what it speaks to is we need good fatty acids that our body really thrives on.
Is that study funded by the American Heart Association?
No, I don't think so.
Okay.
And the other thing, so fatty acids, so fish-derived fatty acids for sure.
Coconut oil, MCT oil?
Coconut oil, yes. I think that actually has been studied and seems to improve cancer-related fatigue.
I saw that.
And then protein. People really need a lot of protein. The range generally is just for an average person is like 0.6 to 1.2 kilogram or grams of protein per kilogram of body weight. So after treatment, I go to the high side of that, 1.2 grams of protein per every kilogram of body weight, and try to get people eating really high quality protein. And so high quality protein, high quality fats, overnight fast from a dietary perspective are kind of the keys. And then
so when you say high quality protein, you're advocating animal products, right?
I'm fine with animal products. I think that high quality protein for me can, from a vegetarian perspective, include legumes, tofu, seeds, nuts, eggs. And then from a non-vegetarian perspective, grass-fed or wild meats, fish, organic poultry. Yeah.
Okay. You worried about lectins?
There's many things we can worry about. So lectins hasn't made my list recently.
So you mentioned protein. I saw one of the studies used branched-chain amino acids as part of the protocol.
Yes. I think branched-chain amino acids are really helpful for cancer-related fatigue. And I think that that's probably where supplementation is the easiest way to get that in. So getting like a protein powder with a good array and amount of branched-chain amino acids, people can really subjectively feel the difference pretty quickly with that.
So which nutritional supplements can be beneficial for patients with cancer-related fatigue?
So there are many, first of all, and the first thing that comes to mind, of course, when we're thinking about circadian disruption are adaptogenic herbs. And there was actually a really nice study that was done using Panax quinquefolius, or American ginseng, specifically on cancer-related fatigue. And they started the Panax quinquefolius, it was, I think, 2 grams a day during the treatment, and then they continued it beyond treatment for 8 weeks. And there was a substantial reduction in the degree and the severity of the fatigue in people taking the Panax quinquefolius. And so that really just speaks to the role of preserving the circadian rhythm, which is one of the things that these adaptogenic plants do. So I use Panax American ginseng often. I also use an adaptogen called rhodiola, rosea, which is, although adaptogens aren't sort of like energy pills, there are some adaptogens which are a little more energetic than others. And so rhodiola is one. It just really increases people's physical stamina, their mental clarity. So I find that very helpful. And there's also adaptogenic blends, which work beautifully for people. If people are really depleted coming out of therapy, I'll probably start a little more gently with something like ashwagandha. And you often dose that at night because it has a little bit of a sedative effect to it. So I definitely use that. Then I think about mitochondrial support. And, mitochondrial support can get very complicated, but I think fundamentally CoQ10 is critical. And I happen to favor ubiquinol as the form of CoQ10, and I dose it pretty aggressively. So I'm giving people like 100 milligrams 2 or 3 times a day to really try to get their CoQ10 levels up and to try to improve their mitochondrial health, because the mitochondria themselves become oxidized and they need to get that redox balance back. Along those same lines, I'm also a fan of glutathione. And I will use glutathione, reduced glutathione post-treatment. That's not something I use concurrent with treatment. but post-treatment to help replete people's redox potential or antioxidant levels. Typically dose that in the morning, and that can be quite helpful for people too. And that supports, of course, mitochondrial function.
You like a liposomal form?
I don't need a liposomal form, actually. There's some good data by a researcher by the last name of Ritchie at Pennsylvania, Hershey State, Pennsylvania, something, University of Pennsylvania. Okay. I can't quite get his university quite right, but he really eloquently demonstrated that glutathione is very well absorbed orally, and it increases glutathione levels in various bodily compartments in accordance with the dose. Doesn't need to be liposomal. Liposomal, I think, probably does enhance the glutathione absorption even more, so especially if there's compromised intestinal integrity, which often is another sequelae of chemo, for example, or radiation, then liposomal might be even better. But, if it's a cost issue or whatever, I think just straight up reduced glutathione works well.
L-carnitine?
Yeah, so L-carnitine is a good one. It's been studied, and it for sure reduces fatigue, particularly kind of muscle fatigue. And it's particularly good for people who have had radiation. And L-carnitine is effective, but it needs to be dosed at 4 grams a day. Anything less than that just doesn't work. The challenge with L-carnitine is that if somebody's had a taxane chemotherapy, it can make peripheral neuropathy worse. So it's contraindicated in people who have had taxane chemotherapy. Other people seem to do fine with it.
Is that just acetyl L-carnitine, or does it not matter?
No, it's all of it. L-carnitine and acetyl L-carnitine.
Okay.
So acetyl L-carnitine is the one that I use when I want to address the fatigue, and I also am concerned about heart function, which I didn't really speak about, but can be another contributor to fatigue. There are some cardiotoxic, both chemos, some radiation, and even in these targeted therapies or hormonal therapies that can make it a little harder for the heart to function optimally. So supporting heart with CoQ10, acetyl L-carnitine can be very effective.
Good. Interesting. What about exercise recommendations for
Oh, I'm so glad you asked.
I remember I met you at that 2010 Institute of Functional Medicine conference on cancer. And I think Keith Block showed a video of patients roller skating attached to getting their chemo infusion at the same time. And he had a treadmill in his office, and patients were on the treadmill getting their infusions. And
Yeah. So exercise, absolutely critical. So we know that exercise rebuilds mitochondria and rebuilds their functionality. We also know that exercise helps to increase hypothalamic pituitary adrenal resilience or reinstate circadian rhythm. So I'm very specific about my exercise recommendations for cancer-related fatigue. So most people are very tired and it's hard to exercise. So I talk to them about figuring out where their fitness level is, being right on the edge of their fitness, exercising at that edge, and then continuing to move that edge out so that they're getting more and more fit. But they have to be reasonable, start where they are, and then just keep pushing. So that exercise, as I say, should always be fun and never really easy. And what we know from a data perspective is that people who exercise aerobically, and actually a combination of aerobic and resistance exercise, it seems to be for at least 45 minutes a day at a level that's moderately strenuous or strenuous to them, at least 5 days a week, have a much lower duration and severity of cancer-related fatigue. So exercise is absolutely an evidence-based, very effective recommendation.
Great. What about a little bit of caffeine from organic coffee or green tea?
Yeah, I'm all about it. Not only because caffeine as you said a little bit, so, in the morning, not kind of giving too much stimulation to the nervous system towards the end of the day, but in the morning, caffeine not only helps to, in some ways, actually reinstate the circadian rhythm by kind of creating that sympathetic nervous system responsiveness, but caffeine and coffee, both, and tea, are inversely associated with cancer risk for almost every cancer that we've studied. So coffee drinkers have a lower risk of recurrences, therefore. And plus, from a botanical perspective, coffee has been used to address people with kind of mental fuzziness. So it's a cognitive enhancer, and that's one of the symptoms of cancer-related fatigue. So coffee is also going to help stimulate cognition. So yes, I think it's actually a very medicinal suggestion.
Great. So thank you so much for spending some time with us, Dr. Alschuler. How can listeners get a hold of you to find out about your programs? And
yeah. Well, thank you for having me, first of all. And I'll give a couple of things for listeners. For practitioners, you mentioned TAP Integrative. I really encourage you to check it out, tapintegrative.org. And if you use the code, let me make sure, WEITZ,
yep,
then you get your membership for only $99 a year, which is an awesome deal. It's
all right.
Political protocols and all that stuff. And Dr. Weitz doesn't make any commission on that, just so you know. It's just, we love him. And so yeah, tapintegrative.org. You can find me on that site as well. Just there's a place to shoot an email there. And then for patients, I think you mentioned our radio show, which is 5 to Thrive Live. And that's now streamed on iHeart and Spotify, and so that's easy to find. And then we have a personalized online cancer survivor program, which I really encourage people to check out. It's actually available now through AICR, which is really cool. And you can also find it directly on ithriveplan.com.
That's great.
And that's free.
Thank you, Doc.
Thank you.